Good day to you. I'm Dr. Mrs. Nithanjali Mapitigama, Consultant Community Physician, National Program Manager for Gender and Women's Health Program at the Family Health Bureau in the Ministry of Health. And today I will be talking about gender roles and young persons. So the objectives of this today's presentation is to describe what is meant by sex of a person and define and describe gender, then to describe the difference between sex and gender and how gender roles affect the well-being of young persons, and to measure to mitigate the differences related to gender roles, define what is gender-based violence, and look at dating violence. So, the basic concepts that we would be touching on is difference between gender and sex, then unhealthy gender concepts affecting the well-being of young persons, and how do we address the issues related to gender, and how do we respond to gender-based violence. So first, sex. What is meant by sex? Sex refers to the biological and physical characteristics of an individual. So in summary, simply it means biological sex, males and females. So then what is gender? Gender refers to the socially constructed characteristics of the women and men. And these characteristics are described as norms, roles, relationships between groups of women and men. So, gender refers to the social definitions and social expectations associated with being a male or a female. And there's another word called intersex. Intersex means this is the term used for a variety of conditions in which a person is born with a reproductive or sexual anatomy that doesn't seem to fit the typical definitions of a male or a female. So he or she can't be categorized into a male or a female because it's not the typical characteristics of a male or a female. For an example, if a person is born appearing to be a female from the outside, but having mostly male typical anatomy inside, it is called intersex, and vice versa. Then what is transgender? Transgender, or we can call it transsexual. So transgender denotes or relates to a person whose sense of personal identity and the gender does not correspond with their birth sex. So there is non-correspondence. The birth sex is different and their personal identity of gender is different. That is why these people are called transgender. Then if we talk more about gender roles, as I said earlier, are socially constructed, and they are constructed by the society based on an extension of biologically determined social functions. Now, the social functions which are normally determined biologically would be extended further by this socially constructed norms of gender. So, gender roles are usually centered on the conception of femininity and masculinity. And because they are being constructed by the society, they are taught norms and behaviors. They are not born behaviors. They are taught norms and behaviors. And because the society develops it, this varies from society to society and also from time to time. And when individuals or groups do not conform to the gender norms developed by the society, they face stigma, discrimination, then social exclusion, and also punishment. And these things adversely affect the health of the individual or the groups. So if we compare masculinity with femininity, so physically, a male should be strong, brave, athletic, and a female should be caring, submissive, and in the functional aspect, the male should be the provider, the breadwinner, and the female the receiver and the nurturer. Sexually, the male should be sexually aggressive, and there is no concern for virginity in the society with regard to males, and single status is acceptable. On the other hand, with the female, sexually should not be aggressive, and the virginity before marriage, the society expects virginity before marriage, and being single is not that acceptable in the society. With regard to work, sometimes they get higher wages in some societies and more men in management. And females get lower wages and less women in management. But when we consider this in our country, in the government sector, there is no difference between the wages, but sometimes it happens in the private sector or in the labor sector. So emotionally, the male is supposed to control his emotions and his passions. He's not supposed to express them. But the female should be emotional, should be sympathetic, receptive, and should have high language skills. Intellectually, the male should be logical, intellectual, rational, and practical. And female is considered as irrational by the society. Then the interpersonal relationship. Male should be the leader, should dominate, and should be independent. The female should be dependent. So, social norms. The male should maintain the ego, and the female should maintain the relationship. With regard to politics and economics, economic growth is of high priority for the male, and conflicts should be resolved through force. And on the other hand, for the female, environment is of high priority, and conflicts should be resolved through negotiation. With regard to religion, normally the society expects only men to be praised, but with regard to femininity, both men and women would be accepted as praise. So the definition of gender, as I said before, is the socially constructed roles, behavior, activities, attributes that a particular society considers appropriate for men and women. So gender role is a set of social and behavioral norms which are generally considered as appropriate for either a man or a woman. So there are two sets, one role for the man and the other role for the woman. And within a social or interpersonal relationship, for the relationship also there is a role and norms developed by the society. So when we talk about gender, there is certain terminology that we should be aware about. So one terminology is gender equality. Gender equality means equality, the word, the meaning of the word also tells us that it is a condition where everything is equal. Women and men participate as equals, have equal access to resources, equal opportunities. And there's another word called gender equity. Equity means fair and justice treatment according to the requirement or need. So that is, according to the requirement, there would be justice, that is equity. So by looking at this picture, you would be able to understand the meaning of the two words. With regard to equality, the resources would be allocated equally. So although the need is different, the three boys are of three different heights, but they have been allocated the same bench with the same height. So only the person, the highest, the tallest person would only be able to pluck the fruits. But on the other hand, with regard to equity, they have been supplied with benches according to their heights. So all the three would be able to reap the benefit of the fruits. So equity is better than equality, because first we should reach equity, we should look for equity, but when we reach equity, knowingly or unknowingly, we would be reaching equality. Then there's another word, gender stereotyping, which is really important. This is the image or the frame or construct which has been created by the society for the man and the woman. So the man or the woman should behave and should practice according to the construct or the image constructed by the society. So as I said before, those who comply with the stereotype or the image is rewarded by the society. Those who do not would be rejected or penalized. So if we compare gender with sex, these are the differences. Sex is universal and biologically constructed, but gender is not universal. It's different it differs with the society, because it's been developed or constructed by the society. And gender roles are, and the behavior is learned and performed. But with regard to sex, it's inborn. And the status, we look at the status, sex, the status is ascribed, but with regard to gender, it's achieved. Gender changes with time, but sex is not subjected to change. So with regard to gender, we use the terms masculine and feminine. With regard to sex, it's male and female. So sex most of the time cannot be changed because it's permanent and it's biologically determined. But gender can be addressed if there are any negative aspects of it. If there are any negative issues, it can be addressed and it can be changed. And with regard to sex, power and privileges are not equally distributed among males and females. There is I think similarity between the two, because here also power and privileges are not equally distributed among gender, but here the difference here is the difference or inequity had been developed by the society with regard to gender, but in the sex it is already biologically determined difference between the man and the woman. So if we look at the health inequalities related to gender, and if we compare males and females, the life expectancy is lower with, compared to females in males, and injuries would be higher in males compared to females. Toxic occupational exposures would be higher in males. Mortality again is higher in males, and social discrimination would be higher in females, because that is how the society wants it. So impact on gender, especially on women, because of this gender roles and norms and the behavior patterns, how does it impact on the women? One impact is suppression of economic gains, because they are not supposed to get engaged in economic activities. Lack of access to social networks, they are not supposed to move in the society. Limited participation in political arena. Lack of access to information and education. Then investment and nutrition is only mainly at the household level. And because of their roles, the time they can use for health services or others for their use is minimum. So they tend to neglect themselves. Social impacts of ill health would be seen among them, and lack of self-confidence and lack of self-esteem, because they are not confident enough to make a decision for themselves. How does it affect on men? Impact of gender on men. Because of their gender role as men, they are under enormous pressure, because they have to be successful in their work, and they have to earn high incomes and also provide for the family. And they are not expected to express their emotions, and they are not expected to request for help, right? So, and this is called as boy code, and this has psychological consequences. And also they would be exposed to occupational risk factors. They would be vulnerable to occupational risk factors. So how does this gender inequality affect the reproductive health of women? Feminine identity is centered on motherhood and the ability to relate to others. So that is what is expected of a woman. She should be a mother, and she should have a good relationship with the other members of the family. So this leads to limitations in her capacity to make own decisions, to act in her own self-interest. Always she has to look at the interest of the, or consider the interest of the other members, family members. So their lack of freedom to make decisions about herself, their selves, would even regarding her sexuality or her reproduction. So that may give to psychological and health costs. And this would lead to limited female autonomy, because they can't make a decision. So sometimes they are being pressurized into early marriage, early pregnancy, and to have large families, because they can't decide on their own for themselves. And also this expected gender role prevent them from exercising sexuality with autonomy, and to detach it from procreation. The use of contraceptives by men is relatively low in comparison to women. Most contraceptive technologies and programs are targeting women more than men. So it had become a responsibility of the woman to practice contraception. The lower ability of women to exercise power and also to access resources in the household might lead to nutritional problems because they don't have power and they don't have access to resources and they are in charge of the nutrition of the family. So this might lead to nutritional problems. And also, the societal standards that tolerate extramarital sexuality only for men leave women vulnerable to sexually transmitted diseases. Now we come to gender-based violence. The biggest negative consequence of gender. The violence which is based on the gender concepts, the gender norms, the gender roles, the gender expectations. So with regard to gender-based violence, I will be touching on what is gender-based violence, the definition, global evidence, Sri Lankan experience, the impact of gender-based violence on health, causes and factors, why is it hidden, the ecological framework if time permits, and milestones addressing GBV and what do we do in health sector. So if we look at the definition, there are many definitions for gender-based violence. So there is no one definition, there are many, but all these definitions try to say the same thing in different terms, but the meaning would be the same. So here this definition is the first definition made by United Nations in 1993, and the definition tries to say that the major terms of this definition is that it should be an act of violence, and that act of violence should occur based on the gender concepts, and this should result in or likely to result in, and they have named the types of violence: physical violence, sexual, psychological, economical, or coercion, threatening, deprivation of liberty. So all these are considered as violent acts. And whether it occurs in the public or whether it occurs in a private space, it is considered as violence. And in the at the beginning, in the first definition, although gender means male and female both, it was mainly targeted for women. The definition was targeted for women. Why? Because 95% of the time, only the women would be penalized because of these gender concepts. But now the term women is being changed to individual, so that it includes both men and women. So if we look at the types of GBV, physical, psychological or emotional. Now most of the time we recognize only the physical violence because it can be seen from outside, but the psychological and emotional violence is not, most of the time is not recognized, but it is associated with any violence. But even if it is physical, it would be physical with emotional violence. And there is sexual violence and social violence. Social violence examples are that they would be uh, cornered from the society. They will not be they would not be allowed to move in the society. So that is social violence, or else there would be the economic violence. Economic violence is that sometimes economically there would be violence, that they would not be supplied with the basic needs like the food and the clothes and etc. By the person who earns or who gets the economical gains. And most of the time only one act of violence will not occur. There would be overlapping of violent acts in a relationship. So if we look at the magnitude of the problem can be compared to an iceberg in the ocean. So we all know that an iceberg, only the tip of the iceberg is seen from outside, and the biggest major portion of the iceberg would be hidden under the water. So this problem is also like that. It is hidden, and what we see, what we read from newspapers, or what we hear in TV news or radio news or whatever, or from word to word or mouth to mouth, is only the tip of the iceberg. So it is considered as a hidden problem. So the reasons for why it's been hidden, there are many reasons, because sometimes I would come to this again in another slide. So there are cultural reasons, and the victim or the survivor would be concerned or would be dependent on the perpetrator, and there are concerns over children and the shame, because it's considered as a shameful thing to say that someone is being battered by the husband. And sometimes they internalize the violence. They think that they are eligible for that because they have done something wrong. So this violence cuts across all ages and all social strata, because it's been divided. The gender or gender concepts are being constructed by the society. So it is available in all social strata across all ages. And in some conditions, some women are more vulnerable compared to other women. That is among displaced populations, when they are using public transport, etc. So when we talk about the evidence, global evidence, this is what the WHO says. The WHO says that 1 in 3 women will experience physical and or sexual violence by an intimate partner at some point in her life. So 1 in 3 is a big percentage, big proportion. 1 in 3 women will experience physical and sexual violence, or physical or sexual violence by the partner at some point during her life. So gender-based violence refers to harmful acts directed to an individual based on gender. That is why we call it gender-based violence. And there are 3 main causes for this violence. So those are gender inequality, abuse of power, and disrespect for human rights. When we consider gender-based violence against a woman, that means violence that is directed towards a woman because she's a woman. And we all know that women are affected disproportionately. What is intimate partner violence? Intimate partner violence means the behavior by an intimate partner. It can be a partner, the present partner or ex-partner, which would cause physical, sexual, psychological harm. So, and it includes physical aggression, sexual coercion, physical abuse, controlling behaviors, psychological abuse, everything. So, it is the same as under gender-based violence. This is one kind of violence that we talk about, intimate partner violence. So, sexual violence means any sexual act or attempt to obtain a sexual act. It might be a sexual act or just an attempt to obtain a sexual act, or other act directed against another person, a person's sexuality, by using caution, and this is regardless of their relationship. And this can happen in the private setting or in a public setting. So it might include rape or otherwise, not only rape, any sexual act which is not tolerated or which is not accepted by the receiver is considered as a sexual violence. Any act of sexual nature, it can be verbal, it can be physical, which is not tolerated, which is not accepted by the receiver, is considered as a sexual violence. So if we look at the Sri Lankan situation with regard to gender-based violence, this is only one evidence. We call it the Demographic Health Survey. This happened in 2016, and the Demographic Health Survey is a world recognized survey which happens in many countries at the same time every 5 to 6 years globally. So the conclusions in these surveys can be compared with other countries as well. So this is, the survey is recognized globally, and according to this survey which happened in 2016, 17% of ever married women across the country, these women were in the reproductive age, and they have encountered gender-based violence by their partners during the last 12 months. And these slides also try to say that gender-based violence exists in all social stratas. It doesn't exclude any social group or any social level. So this was a study done in Sri Lanka among the general practitioners, that is the doctors working in the private sector. And they were asked many questions with regard to gender-based violence to look at their attitudes. And one question was to ask, if there was a conflict or domestic fight, then the question was, women should settle domestic fights by themselves without asking for help. So it's their responsibility, the responsibility of the woman to settle the fight within the intimate partnership relationship. And roughly about 40% of the doctors agreed that it's okay, it's correct. So that is their attitude. Then the second question was, husband can demand sex at any time if he feels like. Again, closer to 40% agreed and said that it's correct. So this is the attitudes of a high class so-called medical officers in the country. And this is another example, and this was on on the back of the three-wheeler, and two pictures. One picture shows that there is a problem. The problem is the shouting or speaking of the woman, and how to settle or solve the problem is to kick her out. So this is also a message to the general public, because everyone sees it. Even the small children going on the road, walking on the road, sees this, and they think that this is normal. So they also would learn from this. There is another study. This study was done among males, and they were asked about sexual abuse, and from men who said that they have done sexual abuse or sexual violence to another person, or perpetrated sexual violence to another person. They were asked why they did so. Men's motivations for perpetrating sexual violence, inclusive of rape against intimate partners or non-partners. This was maybe for the partner or non-partner. They were asked reasons why they did it, and 66.5% of the men who have done perpetrated sexual violence said it's their sexual entitlement. They're entitled, being males, they're entitled to sexually perpetrate another person, another woman. And roughly about 20% said they did it for fun, or they were bored because they were bored they did it. And 13.4% said they were angry, so they did it as a punishment. Roughly closer to 10% said they were under the influence of alcohol, so they didn't know what they did, so they perpetrated sexual violence. So this is called the gender-based violence tree. So it's a huge tree, and globally, gender-based violence is compared to this huge tree. So like any other tree, this tree, the GBV tree, also has all its components. So when we start from the fruits are the negative consequences of violent acts. So it can be rape, it can be death, it can be murder, or it can be an injury or whatever. And the branches of this tree contains all violent acts. So there are enough violent acts for all the branches of this huge tree. Then if we look at the roots of this tree, unlike any other tree which has only one main root, this GBV tree has three main roots, and they are considered as the root causes of gender-based violence. So what are the three roots? Number one, disrespect for human rights. We are born with equal dignity as humans, and any human has to respect the other human. If one human is perpetrating violence against another human, that is, we disrespect for human rights. We are violating the human rights of the other person. So that is disrespect for human rights and abuse of power. Now the society, with the stereotype, the society has given more power to one kind, that is to the males. So if they abuse their power and perpetrate violence on the other person, that is called, and that is regarded as abuse of power. And the third root cause is gender inequality. There are two kinds in the gender, and there is no equality between them. There is a discrimination. Because of the discrimination, one kind is more powerful, and that kind which is more powerful abuses their power and tries to control and use the power or abuse the power for all the reasons. So that is why this violence occurs. So this is called gender-based violence. And there are some reasons written on the trunk of the tree. Although there are 3 root causes and they are the real root causes for this problem, the society doesn't understand this, because these are attitudinal problems. The society only constructs the gender norms and the gender roles and behaviors. So they don't understand. They think that the gender-based violence is because of maybe alcohol, because of the violent society, maybe the impunity, because the laws are not being practiced well, or because of stigma, poverty, lack of education, etc. These are not the root causes, but these things might contribute to the enhancement of violence, or there may be a contribution of these factors to violence. So we call them as contributing factors but not causes. So if we want to get rid of gender-based violence, we have to get the tree by the roots. If we don't do that, if we think only these factors affect violence, and if we cut the tree by the trunk, then again, because the roots would be there, again the tree will shoot up. So for us to get rid of the gender-based violence, we have to remove the roots as well. But removing the roots takes long time, so it needs long-term action. And the factors in the trunk, on the trunk, would compared to the roots, would need short-term action. So we have to have 2 ways, 2 plans for getting rid of the tree. First, to get rid of the contributing factors, plus the long-term action to get rid of the roots. So if we look at the health consequences of gender-based violence, first it can be divided into 2 main groups, which has fatal outcomes and non-fatal outcomes. The fatal outcomes are the homicides, suicides, the maternal deaths, the deaths due to HIV/AIDS, etc. The non-fatal can be divided into the physical injuries which happen, and the mental problems, reproductive health issues, and high-risk behavior which would lead to untimely death. So the WHO also says that women exposed to intimate partner violence are twice at risk of mental health consequences, and also if a pregnant woman is exposed to violence, she has a 16% tendency to have a low birth weight baby. So when we talk about the pregnant women, pregnancy does not stop or lessen the violence, because evidence says, research evidence says that more than 30% of the abused pregnant women have reported that the violence started during the pregnancy. How does this affect children? Although we don't realize, children are the silent victims of violence, and we call them the forgotten victim. So there are many changes in children of violent families. There would be stuttering, there would be panic attacks, there would be many behavioral problems. Sometimes it might lead to delinquency and risk-taking behaviors, and these children have very low self-esteem, and they have interpersonal difficulties. That is, they can't associate with another person. They mistrust others, so they don't have social groups, they don't have social interaction, very poor social skills. Also, they have psychosomatic illness. Sometimes they don't go to, there's absenteeism because they don't go to school. They say that sometimes they have headaches, stomach aches, etc. So, unexplainable illnesses. And also cognitive problems, very poor school performance. And the most negative consequence is there's a higher probability of this person, especially a male, becoming a perpetrator in the future as an adult. And on the other hand, there's a higher probability of the female, the girl child, becoming a victim or a survivor when she becomes an adult. So this is called normalization of gender-based violence. That is, after seeing the conflicts, disputes at home and how the father controls the mother, they think that this is normal. So they try to adopt the same thing into their lives. So if there is violence in one family, that is suffering for 3 generations. The picture explains it all. If we look at the cycle of violence refers to repeated and dangerous acts of violence, and it happens as a cycle. And we call it the cycle of violence. So it can happen many times during a relationship, but what happens is with time the frequency increases and the severity of violence also increases. So ultimately there is a possibility of the violence ending up with death. How does this gender concept affect the adolescents? Mainly, if we talk about dating violence, again, dating violence also comes under the gender-based violence, and it also has the components we described earlier as the acts of violence. It can be physical, sexual, psychological, within a dating relationship. So, as I said earlier, physical, psychological, sexual, repeated texting. Stalking is following a person and disturbing them, harassing or threatening or after following them. And repeated texting, posting sexual pictures. So all this is considered as comes under dating violence, the types. So risk factors for perpetration of violence. What are the risk factors? The attitudes. They try to justify the use of violence. Now they try to connect this with the gender norms and say, I did it because you didn't do it or you did this. So they try to justify the use of violence. And sometimes it may be the behavior, substance abuse, or having risky sexual behaviors because they have started their sexual activity early. They must be having multiple partners. So it's a risk. So we have to consider these things. And peer influence of the others, how the others influence them or pressurize them. So that pressure also matters. Then there are some personal factors. Prior exposure to violence, that is, the prior exposure may be at home, at the home setting, or with the peers, and having a history of aggression towards the friends, the peers, low self-esteem. So they try to abuse the power that they have as a male with the low self-esteem, and lack of life skills. So when the life skills are inadequate, the coping strategies are inadequate, so they try to use when with anger and with blaming, try to get and they try to change the partner. And these are the motives for resorting to dating violence. Anger is one motive. Then for self-defense and desire to take control over the other person, the partner. Early warning signs of an abusive partner. So what are the early warning signs? If we see that these are the signs of my partner, then we would be able to decide on whether to continue or not. So 1, demand details about how you spend your time. And they try to restrict contact with the family or with the friends. So that is restrict social relationships. Or criticize you or what's important to you. So what is important to another person is being criticized by the partner. Or try to control the behavior, the dress code of the partner. Touching the partner in public without permission in a sexual manner, and cause or pressurize into unhealthy activities, and ignore the physical boundaries or violate the physical boundaries. Also try to control the reproductive choices of the other person. So if we look at the health effects of dating violence, so this dating violence would lead to low self-esteem, low self-confidence, which would ultimately lead to unhealthy behaviors like using tobacco, drugs, maybe alcohol, would lead to depression, anxiety, suicidal attempts, suicidal feelings, etc. So, how to mitigate gender inequality? Mitigation of gender inequality. How do we do this? We can generate awareness. Generate awareness among whom? Maybe among the parents, among the whole community, all adults, among the adolescents. On what? On gender-based violence and child abuse. And with regard to gender equality. So when we talk about the whole community, it may be the village, it may be the city, and child welfare, right? To establish creches at all workplaces so that women would be able to gain economic, to do economic activities, or to have social freedom for social activities. Then opportunity for higher education for females so that they can be educated and they can have their autonomy, improve their autonomy, and then also they can have a good occupation, and also to offer scholarships for females to pursue their higher studies, and also to make them proficient in technology, and avoid discrimination and sexual harassment by creating awareness of what discrimination is and what sexual harassment is. To provide equal opportunities for employment for males and females, and to empower women. So to empower women, we can conduct awareness programs using mass media, and even in the community, programs could be conducted, and funding, to increase funding of rape crisis centers and centers for women and girls who have been raped or sexually assaulted, and the law enforcement of the existing laws against gender-based violence, or maybe gender-based employment. Media impact. Confront gender stereotyping by the popular and news media, because media can do a lot, but if there is gender stereotyping in media, that may negatively impact the public. So we have to confront gender stereotyping by the media. Then miscellaneously, medical services should be provided, counseling should be provided, psychiatric treatment. In the political arena, to give more opportunity to participate, especially for females to participate in active politics. In the social arena, social integration, to have social protection programs and safe homes, to establish more and more social welfare programs, child protection opportunities at all this, starting from the community level. So ultimately, to establish a violence-free community. So now we come to response, or how to respond to gender-based violence. So when we talk about responding to gender-based violence, because the gender concept is being constructed by the society, this to respond or responding to gender-based violence is like a jigsaw puzzle, where there are many pieces which has to fit in correctly. So in other words, there are multiple partners. It's a responsibility of multiple partners, and health is only one component, but it's a main component of the puzzle. So these are the non-health services which are already available in the community. So it can be divided into many aspects, social aspects, the counseling aspects, the legal aspects, and also there are the police and the protections, social welfare. So there are many partners in the government sector who are responsible for responding to gender-based violence. On the other hand, in the non-government sector also there are many associations who already respond to gender-based violence. So now I would be concentrating only on the health sector response, because it is the responsibility of the health sector. The main responsibility what the health sector should do is to respond to gender-based violence, and in the meantime, at the same time, to coordinate with the other sectors so that the survivor would get a better response. So the health sector response can be mainly divided into two main categories. The interventions which are aimed or targeting mainly the prevention of gender-based violence. On the other hand, the interventions targeting responding to gender-based violence, that is helping or assisting the survivors who are already facing or subjected to gender-based violence. And for this to happen, we have to create an enabling environment. So sometime back, about 15 to 20 years back, the health sector did not have a response, and health sector was not aware that they had a responsibility until the WHO clearly mentioned that this is a public health problem and this is a human rights issue, and health sector also has a responsibility in responding. So now when we started responding to gender-based violence, we had to create the enabling environment, because the environment was not enabling, not healthy, not supportive, because the this was not included in the basic training of the health staff. So we had to create many material and to have in-service training for the staff who are already in service, and to include them into the basic training curricula of the new recruiters. So to prevent GBV or gender-based violence, we have many programs. There's a package because this affects, as I said earlier, that the gender concept, the negative aspects of gender and gender-based violence affects an individual throughout the life cycle. So at each and every stage of the life cycle, we can intervene. So we have chosen some very important stages. One is the newly married couples. So we have a package for newly married couples, and also it's I think it's mandatory that we create public awareness on the negative aspects of gender-based violence, and that it's a human rights issue. And also we have a package for migrant workers, and also we are doing some work on prevention of female genital mutilation. So if we talk about the package for newly married couples, this is a package that is being provided in the field by the medical officer of health and their team. And here the couple, the newly married couple, is supposed to attend 2 sessions at the MOH office, and at these 2 sessions they would be made aware, or they would be sensitized on some very important topics which would enable them to lead a happy, healthy married life. So that would include the responsibilities of the man and the wife to lead about good marital relationship. Then they would be talking about good sexual relationship and the benefits of non-violence, if there's no violence in the family, so etc. etc. There are many important topics that they would be sensitized on. And after they attend the 2 sessions, they would be given a nicely illustrated, simply written book to, as a takeaway with takeaway messages, so that they would go home and get more information by reading the book. So to create public awareness, we have done many things. We have done documentary films and shown them in mass media, electronic media, and they are in the YouTube, and there are display billboards in public places. There are posters, leaflets, handbooks, so many things to create awareness among the public. This is the package for migrant workers which I was talking about, but because of the time constraint I won't be talking much on it. But this is just to, as we know, we have a very good proportion of migrant workers, and some of them have gone as non-skilled workers, and some of them face abuse at their destination, and their children sometimes are sexually abused in their own families, in their own house. So to minimize this, to create awareness among the members of the family on how to plan the departure, and what plans to be done, and how to sensitize the children, and the roles and responsibilities of the family members with her departure. So we have developed this, and so we are trying to sensitize the family members on the on how to plan for the departure. So if I talk about the response to gender-based violence, how do we respond to the survivors who are already facing violence? So the major program that we have with regard to responding to gender-based violence is creating or establishing gender-based violence care centers at hospitals, and we call them Mithuru Piyasa in Sinhala, or the English version is Friendly Haven, and in Tamil we call them Natpu Nilayam. So this is the name board of the Mithuru Piyasa Center. So if there is a board like this in any hospital premises, that means that hospital has a Mithuru Piyasa Center, and the board also tries to tell a lot about the center and what to expect from the center. So this service center is somewhat similar to one-stop service centers in other countries, but there are many differences because our country is unique, and so this is established to suit our cultural and social setup. So to suit, it's a homegrown GBV care center, and normally it's placed at the outpatient department, and services provided by a trained medical officer and a nursing officer. So these officers are being trained by the Family Health Bureau on provision of services, and their main responsibility is to provide basic emotional support, or we call it befriending, to each and every client who comes to the Mithuru Piyasa Center. And as I said before, this center is linked with other services within the hospital and outside the hospital. So within the hospital, if the client needs any other services, maybe psychiatric, maybe judicial medical officer, or the gynecological, surgical, whatever, they would be referred for those services. And if they need any other services, maybe in-depth counseling, maybe legal aid, or police, or any other social assistance, then they would be referred for them outside the hospital, because they have very good coordination. The center has a good coordination with the other service providers as within the hospital and outside. And if a certain client needs follow-up of her problem, then arrangements are made for follow-up at the same center. And if they like, or if they consent to link up with the field setup, then they would be referred to the field health workers. So this is the pathway of care to the Mithuru Piyasa Center. So normally when a client comes to a hospital, most of the time they come with a formal referral or formal note, but here they don't have to have a formal. Any person can just walk into the Mithuru Piyasa by herself or by himself. Also we get clients from the field health staff, because the field health staff are in contact with the people, with the women, so they get to know about the violence, then they can send them to the Mithuru Piyasa in the hospital. Sometimes they are being referred from the OPD, the outpatient department, from the wards, from the clinics, other field staff who are working, as I said, who are providing services for this problem, or they come on their own to the center. So as I said before, to each and every client, the basic emotional support is provided, and if they require any other services, they are being referred. So our target is to have a Mithuru Piyasa Center in all the hospitals, in each and every hospital where there is specialized care, where there are consultants. So in Sri Lanka, we have about 110 such hospitals where we have specialized care. So at the moment, we have about 75 centers in the country. So in the near future, we would be expanding, we would go for a progressive expansion of the centers so that ultimately we would reach the target. Thank you.